going to record this too. All right,
Perfect.
so turn it over to you, Debbie. And
Thank you. All right, can you all see the screen? Can you all see my screen?
Yes.
Perfect. Thank you, Wendy. All right, thank you. I am honored to be here. So thank you, Dr. Nichols, and thank you, Dr. Woods. There are some amazing speakers, as most of you know, and I feel honored to be asked to share a little bit of what I do with all of you. Most importantly, just advancing the education and then helping you understand what we're doing and why we're doing it. As Dr. Nichols said, ONERO is the big hot word in the US now because we're finally getting it here. So the biggest question is, why isn't a whole bunch of people doing it? Because it's brand new. That's why, here in the US. And I'm going to give you a little bit of, well, a lot of bit of information about it, what it is and why it's a good thing, in my opinion, as well as what you can do if you can't access ONERO right now. But what I'd like to do is I'd like to just talk quickly about, if you were here with us in March, I did tricks and tips to keep yourself upright. It was a fall prevention and really about strength back then. I want to kind of tie that in. One of the things that we talked about posture being really important, working good posture. That's completely in line with ONERO. Balance is super important, and we do that with the ONERO program as well. Proprioception is your brain's knowledge about where you are in space, so we prevent fall. That's super important. And then number 4 today, what we're going to talk about is strength. So all of those things, if you are doing stuff with balance, with posture, with proprioception, even with strength now, don't stop that. We need all of that as a part of your program. As a part of your exercise program, a lot of people are saying, should I stop what I'm doing? No, don't stop what you're doing. We're just going to add this to your mix, okay? So in your exercise program, just analyzing where you are right now, you want to make sure your exercise program is multi-directional. We spend most of our time walking forward in the world. We want to make sure you're doing sideways stuff, backward stuff, turning things. If you love to dance, if you don't love to dance, I don't care if you're good at it. Dancing is a great multi-directional exercise piece, okay? Locomotion, moving. So whether that's swimming, whether that's cycling, whether that's walking, whether that's on a treadmill, where your body is in motion, that's important to your exercise success. Intensity changes. Intensity changes means not keeping the same weights every single time, but changing those weights. One of the things I like to say to my clients is at least have 3 sets of weights, whatever low, medium, and high is for you, and mix it up. You don't want one set of weights really worn out and the rest of them sitting there with the tag still on them and all dusty. Okay, you want to change your intensity, meaning challenging your body. Progressions is starting from one level and gradually moving up, making it more challenging and more difficult. And you can do that in a multitude of ways. The point is don't do the same thing all the time, never changing it. We need you to change that. That's part of the successful exercise program. Functional strength exercises. Functionally, we're moving in the world. You want to do exercises that match that continue to strengthen. So you don't want to do things in the gym that you never do outside of the gym. Okay, so you want to think about, how are you moving in the world? Are you doing strength exercises that support how you move in the world? And then you want to make sure, most importantly, that your exercise program is individualized. As we advance in age, as we all know, life presents challenges, presents health challenges, physical challenges, mood challenges, energy challenges. All of those coexist individually and uniquely to each one of us, and it changes. That's the challenge of aging, right? So we want to make sure that your program is individualized to you on the day that you're working out. So going to a manufactured standardized workout might be okay for a little bit, but you really want to make sure that you're individualizing that exercise program if we want to reach success. Okay, so those are just kind of the basics of really kind of evaluating where you are with your exercise program. Lifetime routines, okay, balance, cognitive proprioception, stability, agility is moving your feet more than just walking. endurance, flexibility, and strength is what we're going to focus on. So again, assessing your exercise or movement in your world, these things are really important to keep included. And a lot of you are already doing that. Just don't take them out. And if there's something missing, let's bring it back in. All right. Here's the prize, right? The reason we're here today. ONERO. What is ONERO? It's scientific evidence-based exercise program specifically for osteoporosis. Different than everything else that's out there, okay? There's a lot of programs that say, here's an osteoporosis program. This is safe for osteo. There's a lot of things out there that are safe. This is the only one that is evidence-based, okay? That's a really important piece to understand. It is also a supervised program, and you'll hear me say that several times today. The reason this program is as successful as it is because it's supervised. This is not something that you're going to do unsupervised. It's bone targeting. There's high intensity resistance, impact. It reduces osteoporosis fracture. In the specific study, postmenopausal women and older men with low and very low bone mass. So people will ask, am I too low to do this? Probably not. We're going to assess you and look at you, but this is where the study was done. Again, this is what makes it unique. We didn't take healthy people. We took you. This exactly the people that we're working with. That's who was in the study. Okay.
Are you sharing slides? Because we don't see.
Yes, is it not sharing?
It's not sharing.
Okay, let me go back. Hang on. Thank you. What are we seeing? Just the screen?
We see you and your gym, which is lovely.
Oh, well.
We don't see your slides.
Okay. Hang on. Let me do that real quick. I thought we did that.
I do have a copy. If you can't get them up, I can share, but you'll have to tell me when to advance.
Hang on. I had it a minute ago. It was up.
Yep, now we see them. Okay.
Hang on. Let me go to slideshow. There we go. Okay. There was slide number 1.
Yep.
There was slide number 2, our balance,
Okay.
posture, proprioception. There's slide number 3. Here's the successful components of your program. Multi-directional locomotion, intensity, progressions, functional, individualized. We're doing a quick overview. See, I'm not gonna have to do the summary right here. All right, your routine, what's in your routine, all of these things need to be there. This is where the definition for ONERO, okay? Supervised, high intensity impact, reduces osteoporotic fracture in postmenopausal and older men with low and very low bone mass, okay? It is evidence-based, and the evidence proved that this improves bone physical function with people with low bone mass when supervised. Okay, when supervised. This was clinically significant published data. And here's another important piece. This data was done in 2016, published in 2017, and has continued since 2017 with a consistency that we saw in 2016. Okay, so we have a long time of this evidence continuing. And the only difference that we've been seeing is that we're working with more people with higher level of osteoporosis. So their numbers in terms of severity are more severe than what we did in the original studies with the same kind of evidence. That's the beauty. Here's just a quick overview of some of the things, the key things of the data. I know this group loves data, so we'll go through this just really quickly. In row number 1, well, you'll see weight. It says 1%. These are percentages. Weight increased by 1 pound, or 1%, sorry, not 1 pound, 1%. 1% meaning that was most likely muscle mass, lean mass, muscle mass, and I'll show you why in the next one, okay? The second one, height, we didn't see real significance in height improvement. Third, lumbar spine, bone density, bone mineral density, 3%. Your femoral neck bone mineral density, 1.8% improvement. Whole body, 2.3%. Here we go. Lean body mass, 2.3% improvement compared to fat loss, losing 4.2% fat. So this 1 1 pound of weight gain over here is most likely that muscle mass. All right. Kyphosis, we decrease the level of kyphosis by about 7%. And then these next, the functional reach, your tandem up, timed up and go, tandem walk, 5 times sit to stand. These are all just assessments that we did. And those decreases were that people were able to do those faster, which is what we want that to happen. And then your back extension strength. Okay, so those are quickly what the changes were, and you can have access to this. This is totally public information. Okay. All right. Again, scientific evidence-based exercise program. Here's the key to ONERO. ONERO is very different than the training program that as a trainer I've done for years, where I go to a training, I get the training, I get a piece of paper that says, yay, Debbie, you can teach cycle, or you can teach spin, or you can teach body pump. There's very little that I have to do when I'm doing that certification. That's a certification. ONERO is a license. ONERO requires a license to deliver it. You cannot deliver the ONERO program, unless you have an active license. The licensee is required to meet specific standard of care, specific education, and identified experience. The licensees were all monitored. We have a standard of ethics, and we're responsible to protect the intellectual property of ONERO, which is why this is so tightly held. We'll talk a little bit about what that means. The licensees are required to maintain active status to legally deliver ONERO. So if I don't have an active status in my license, I cannot continue to deliver ONERO program. This is one of the reasons why when you go out on YouTube to try to find what's ONERO all about, and there's very little out there. That's because we're required to protect that intellectual property, and because this stuff has to be delivered with supervision. We'll talk more about that in a second. Why a licensed ONERO provider, practitioner? The risks. We're dealing with a population that can break. We're dealing with a population that has very complicated, what we call comorbidities, or those challenges that come with aging. This is not something that we want to just hand out haphazardly and have a bunch of people doing it with the population that we're working with. So it requires a license, it requires an active license, and somebody with the training and the license, active license to carry it out. I, for example, cannot post any pictures. You're not going to see any pictures in my slide of anybody doing any exercise, because I don't want to share that information and have you think, oh, I can do this at home. I know how to do it. We'll talk in a little bit more about that. Knowledge and understanding of osteoporosis. The licensees have that. Licensees have a knowledge and understanding of medications and how that intervenes. I have a lot of clients using medication and doing the exercise. That's 100% okay. Whether you're taking or not taking, choose to, on, off, doesn't matter. But I need to know if you're on, if you have been, how it affects it, and we work together with that knowledge. Necessary modifications. Every single individual in my program has some sort of modification. It just is what it is, and that's part of how we do what we do so successfully. So you have to have that knowledge of being able to manage all of that and create modifications, and then create safe progressions. How we're building bone is we need to build that strength, and we need to build the weight. The only way we can do that is with safely progressing you little by little by little. I'm not going to throw 150 pounds on you if you've never lifted before. I'm not going to throw 150 pounds on you if you haven't been lifting for quite some time. So we do that very safely and progressively in baby steps. The difference of ONERO. So a lot of people know, kind of, if you're reading the study, you know, all right, this is a basic shoulder press, or this is a basic squat. For years, I said to myself, I don't need ONERO. I know how to do this. I've been training for years these techniques in the gym. The difference is what I have learned in the past, and what I've taught in the past and trained in the past and coached in the past, is a strength building exercise. It's a wonderful exercise. What ONERO does, our focus is bone building. It's very different. So the squat that I have taught for years in the gym is very different than the squat that I'm teaching in ONERO. because in the gym, it was strength. In ONERO, it's bone building. So they're very different. They're very specific. So if you go on and you read it, you're like, I know how to do all this. I'm going to do all this. It's fine. I'm going to be able to do it. I don't have to do ONERO. You're doing exercises that are strength. You're doing exercises that are benefit. It's not bad. It's just not ONERO. So ONERO is we're driving that for bone building. We're looking for that in all the technique and postures. All right. So what are we doing when you come in and you see us? So I borrowed this from Dr. Woods. Thank you, Dr. Woods. We're doing all of these things. The first thing is, this is Dr. Woods' 4Ms, and I love it to death. Okay. Mindset. When people walk through the door, you have to have that mindset that you're strengthening your body and you want to do what's best for your body, and exercise is going to be a part of that. The focus of what do I have to do to make a change with this, with your DEXA scores, with where your physical body is, with what you can do. I am really blessed with most people that come through the door already have that active mindset. They already have, I know what this is. It's an exercise program. I'm going to have to work to make a difference. That is key to success. We talk about meds. I'm very clear about what's going on. What do you have? What questions? I probably give my clients way too many questions, Dr. Woods will probably say, because I'll say, ask her about this, ask her about that. What about this? What about that? We're trying to get as much information about education to you about what your options are and what's happening on the med path, medications path. We'll talk about meals. Meals and protein is probably one of my biggest things that we talk about. We talk about calcium, but that's Dr. Woods and the doctor's big, they're good with that. I'm going to support that, but I'm really going to monitor your protein. Protein is the muscle builder. We need it to build muscle. We have to have enough of it to build muscle. If we build muscle, we stimulate bone. So we talk about what's going on your plate, what can you put into your body, how can we support your meals so we can support strength, so we can support your bones, all right? And then fourth, obviously, is what we're talking about, your movement piece. So these 4 things, your mindset, the medications, whether you choose to or not, you have the education around what medications are options for you, maybe now, maybe never. Your meals, why protein is so important and how much do you need, and then your movement piece, your exercise piece. And people say, should I stop doing the things that I'm doing? Most often, no. I'm going to say do all those things. Do your Pilates, do your walking, do all those things, but we also have to bring in the strength piece because everything has its benefits, okay? So we're not necessarily taking anything out. We're just adding in this strength piece. And when we talk about strength, let me go real quickly back to the movement piece. When we talk about weightlifting or lifting heavy, because we're not just talking about lifting weights, we're talking about lifting heavy. And what I tell people is it's not a 3-pound weight. It's not a 5-pound weight. It's not an 8-pound weight. Those are light weights when we're talking about ONERO. So if you're still lifting 5s and 3s, we're going to build you from there, but we're going far beyond that number. Because bone needs more weight. We need to build strength, and that's that gentle progression to get you beyond that. So if you say, hey, I'm really happy with my 8s, I'm happy with your 8s too. We're probably not building much bone with that. We're probably building strength, stability, balance, flexibility, your functional exercise throughout your day. All of that is great stuff. We're just not getting enough to stimulate bone. And that's the difference, or that piece that we want to put in to your exercise program. All right, your path to ONERO. This is so you have an understanding of what it will take and what you need to do to begin an ONERO program. You're going to have a consultation with a licensee. You're going to then have an evaluation and assessment in person with a licensee. You're then going to need to do pre-ONERO training. We need to know that your posture and position is almost perfect before we put you into a group. I want to know that you're safe, that you understand, that you don't have any questions about what you're doing when you come into the group. Usually the pre-ONERO training takes 1 or 2 one-on-one sessions, sometimes 3, usually not beyond that. But I'm doing individual training to get you to understand your body and how to keep your body safe before you come into a group. Then you enter a group. Can you do ONERO one-on-one? Absolutely. Okay. Different story there, but you absolutely can do it one-on-one, supervised, or you can go into the group. Most people are going into groups. Group, what does group mean? Max 8 people. That's it. Okay, that's it. You see my gym here? We've got 4 stations, 8 people. That's all I have to watch when I'm doing a group. Recommendations are 2 times per week. Okay, can you do it 1 time a week? Sure. 2 times a week is going to be better. All right, the recommended in the trial was twice per week. If you only can handle 1 for whatever reason, time, energy, distance, whatever, that's better than nothing. Okay, we also have some online stuff that you can do in terms of from my program that is heavy lifting with dumbbells. That's virtual training. It's not ONERO, but it can support you in your home program. Okay. Is ONERO ongoing? People always ask me, how long do I have to do this? Well, I like to say, how long do you need to exercise? If you stopped exercising, what would happen to you? So yes, ONERO is ongoing. We need to manage the bone loss for the rest of your life until we have an answer to osteoporosis, to change it, to stop it, to do. But we don't have that answer yet. Exercise. No doctor's ever going to tell you to stop exercising. This is part of your exercise program specific to bone. So yes, it's ongoing. Movement matters. Again, I don't care what you're doing, just move, okay? Whether you can get into an ONERO program or not, move. Start lifting weights, start getting your body moving. If you don't feel comfortable lifting past 8 pounds, then don't. Do what you can do, but movement matters. Don't just sit and do nothing. That's my recommendation, okay? We want to maintain muscle mass. We want to build your strength. We want to build your balance. These exercises do that as well. And most importantly, we want to build your bone mass. All right, summary quickly. Keeping your current program. If you have doing, some people will change some things, but for the most part, stay moving. Okay, we're focusing on strength with heavy weights. ONERO is a process that requires supervision. Okay, our timelines. Let me just be real clear. I am one of the only people in Southern California doing this, okay? There is somebody up in Encinitas doing it on a much smaller scale. We've got somebody brand new in Pasadena, although was really impacted with the fires last night. But there is a brand new program up there. That's all we have in Southern California right now. We have a couple folks in Northern California, somebody new in Scottsdale. That's as close as we get. It's building. That's probably quadruple of what we had 6 months ago. So the good news is ONERO is growing. The bad news for the moment is it's really small. So my timelines, to be very honest with you, I'm booked out by 2 months now. Okay. So if you're interested, we're waiting by 2 months to get you in. All right. I'll talk in a minute about how we're going to get you that information. Okay. Actually, I'll do it right here. So look at this technology. It makes me so happy. I was so excited to do this slide. So all you got to do is put your camera up and do that. Take a picture of that, your camera there. Your camera will focus on that QR code. You click on it. It's going to take you to my website. Or you just old school, the bottom gray box. You're just going to send an email to info@serbanwellnessandfitness.com. If you are interested in doing an informational session. We're doing an informational session next Monday, the 13th at 5:30 on Zoom. If you are interested, go to info@serbanwellnessandfitness.com and say you want to be included in that Zoom call, and I will send you a Zoom link. There's also another one on Tuesday, the 28th at 4. I will be giving detailed information in those informational setting. It's not, you don't need it right here. But that's what we'll be doing then. Okay. So that being said, I'm sure we have 5,000 questions. I'm going to leave this up on the screen for a second and I'm going to jump. Oh, did I just turn you off? Okay. I'm going to stop sharing. All right.
Debbie, there's a lot of questions.
Yep.
On more of accessing the links after accessing Trumba and so on. Let me just, so I'll skip through those. It might be easier if I just go down to the meat of the thing and then turn the question over to you. But in the meantime, let me just say to everyone, I just put the link to Trumba, which is the platform that we use to register for our monthly talks. I'm not sure how anyone got on today without going through Trumba. But anyway, take a look at that. Please register yourself on Trumba. It's again, UC Health wants all these kinds of programs using that platform. All right, so you've already answered some of these, so let me
Jean, I've got the chat box open. Thank you so much, Deb. That was fantastic. And we're so delighted to have you here in San Diego, and grateful that you were willing to get licensed so that we can offer this program to our patients. There was a question about doing ONERO if you've had a vertebral fracture.
Great question. As long as you are healed, it's totally safe and totally fine. So I have several clients that have had vertebral fractures. That does not preclude you from doing the ONERO program.
Great. Good to know. There was a question about the benefit of doing stomping exercises on hard pavement when walking. Will this improve bone density?
So stomping or heel drops, that's great. That's good to do. And I'll actually show you something really quick that you can do at home. Okay. So what we're typically taught is to roll, to land nice and soft like a cat. Okay. That's not what we're doing when we're doing foot stops. We want to land hard and flat. Okay. So if you think about your heels, you can just do heel drops, not rolling, but actually letting your heels drop strong. You can do that at home. You can do stamping at home. You can do flat foot jumping at home. As long as your bones, your ankles, your knees, your hips are okay with that, I would suggest starting out with 10. And then wait till tomorrow and see, what is everybody saying? What are my knees? What are my hips? What is everybody saying about this? If your body's like, cool, then do 10 more. Then do 10 more each day to see how you're feeling. Some people are really sensitive and it doesn't work. Others are totally fine. But it's really about the impact. And if you think about your heel dropping first, you're going to not do that, what we all learned how to do, jumping really soft with low impact. That's a great exercise. That's not what we're doing. So the heel drops, what we call heel drops, is you're really looking for just landing strong on those heels. And this is the first progression, number 1. Great question. And you can all do that at home. That's not an issue.
Okay, this is a tough question. I don't know if we'll be able to answer this. This is probably for both of us. Outside of muscle strength, balance, and flexibility, will exercise improve bone density or structure if the patient is on a bisphosphonate or denosumab? So where bone turnover is low. I know there was a study where they combined ONERO with medications, but I cannot recall the details of the study design or the outcomes. I don't know if Dr. Nichols can recall that off the top of her head. My take home, if I'm remembering correctly, was that both were effective, but there was not necessarily an additive effect observed in that particular trial. Does that sound familiar to you, Deb or Jean?
I know that Dr. Beck in Australia did that, and there was benefit whether there was meds or not meds. So I don't know if that answers the question.
Okay.
There was benefit.
Okay, great.
And I have clients that I've been working with for 5 years that probably about half of my clients are on meds and half are not. And we're seeing benefit in both groups.
Great. There was a question about, can you participate in ONERO remotely? I think you
No. Yeah, no.
Okay.
There is, so if you can't get here, there was that little kind of plug I put in. I've been doing bone strengthening work with dumbbells for a really long time. Those exercises you can do at home. Those exercises you can do remotely. That's my signature program. It is not ONERO. We have had very good success with it, but it's not ONERO. You just need to know the difference. Okay. I'm not going to teach you ONERO to go home, but there is something that you can do in the meantime. And there's definitely something that you can do remotely.
Great. There is a question in here that comes up frequently in my clinic about carrying a weight in a backpack, rucking, or a weighted vest. What's your take on the effectiveness of these things for spine bone density?
Great question. What we found in the research so far, there's not a ton of it, but what we found and what we've seen is that the vests that have, so not super heavy, about 8 to 10 pounds. You don't need 20, 30, 40. We don't need those. About 8 to 10 pounds equally distributed. So if you just take a regular backpack and you're throwing 10 pounds in the back and you're walking, that's not good. Okay. We're working really low back issues there and thoracic spine issues. So we want you standing with good posture, equally balanced on the front and the back. So if you have a weighted vest that's somewhere between 8 and 10 pounds, it is an equally weighted one. So some of them have adjustments. You want the same weight on the front as you want on the back. And we're seeing benefit from that. But there's no clinical trial that's right now anyway that says that's a good thing and it builds bone. Personally, I don't see a problem with it. I have a lot of people doing it, but that distribution is really important.
May I add something to that?
Yes,
quickly?
please. Yes.
And this is an old study, and it was in premenopausal women, not young kids, but premenopausal women. This is Christine Snow out of Oregon Health Science Center, and their group used weighted vests, and they did find improvement relative to a comparison group. It was not a randomized trial, however, but they did find a % or 2 improvement, and they systematically increased the weighted vests. So they did the vests that spread the weight throughout the trunk area. And they went up to gradually increasing to no more than 10% of each individual's body weight, right? So if a person weighed 100 pounds, the most they went to was, 110. And so, again, that goes back a ways, but I can also tell you way back in my early days here in San Diego, we started a study using weighted vests, and the design was not very good and the weight couldn't really be spread. And I had several women start to say their lower back hurt. So I stopped the study. All right. So that what you're saying, and so what Debbie's saying about making sure if you're going to do something like that, it's in a program where that weight can be distributed. Okay. All right.
Jean, to clarify that, was it a maximum of 110% of the person's weight or 10%?
No, 10. They added. So the maximum was 110% of their body weight. All right. So, okay, 100-pound person, 110 pounds would have been the most they added.
So they were carrying a
backpack.
Yeah. And they were doing
a lot.
Impact moves for the most part.
Okay.
No. Okay.
All right. Deb, you touched on this, but there's a question about how do you take into account a person's size when determining how much weight they should lift?
So the determination on how much they're lifting really is individual. Okay, so depends on your strength. It's not about your size, it's about your strength and about your technique. So I've got people in here that have crazy strength and really poor technique. They're not going to lift very much. I've got somebody with excellent technique and never lifted before. Those people can progress much, much quicker. So it really depends on the individual. I'm looking for posture and position first, and then we're progressing with that individual, but it's really individual. It's not like there's no recipe to it.
Great. Any COVID precautions? Are participants allowed to wear a mask to class?
Yes, I have air purifiers that are on all the time. I have doors that are open, and if you want to wear a mask, that's fine. I have regular people that wear masks. It's not a problem at all.
Okay. How do you accommodate weightlifting in a person with a lot of joint problems?
So that's going to be part of our evaluation and assessment. We're going to look at all of that. And one of the key things with ONERO is that we've got a lot of options in terms of being able to lift. So it's going to, do I have people with joint issues? Yes. Do I have people with lots of joint issues? Yes. Are they successful in the program? Yes. Are they going to progress slower? Maybe. Are we going to do modifications? Absolutely. So it really depends. I mean, I have huge heavy bars that are 45-pound bars, and then I have wooden dowels. That's just a wooden dowel that weighs almost nothing. So there's a huge array of where we go with what's happening with the joints, and we want to get that posture in position and see where you can go. Usually when we start to move, we start to build a little bit of strength. We start to be able to work within the limits of whatever joints are going on. We've got a lot of shoulder stuff, a lot of replaced hips, a lot of replaced knees, a lot of osteoarthritis, a lot of stenosis. So we're dealing with all of that. Frozen shoulders are a regular occurrence here. So yeah, we're working within all of that stuff.
Great. And we have a question about vibration plates. Are these effective for building bone?
So that's another one where the data really isn't, it's not significant either way. Dr. Beck actually has done her own study with that. It's called LIFTMOR. That study came out flat, which was no significance at all. Which on one side is there was no injury, but then there was no benefit. So right now, I haven't seen anything that really says, yeah, go out and spend $3,000 on a vibration plate. If somebody has access to one, or you've already purchased one, there's definitely safety considerations on the time that you're on the plate and that megahertz that you're within. It seems to be that the plates that are out there now are within those safety zones. So it's sort of like no harm, no foul. If you have access, I don't make a recommendation either way, because the data isn't out there. We could get data that says it's great, but right now we haven't. It just isn't, it's a nothing. So I just say it's up to you at this point.
Okay. This is an interesting question, and we've talked about this. Is ONERO covered by Medicare, and why not? And you can maybe share your perspectives from speaking with Dr. Beck about Australia versus the US.
Yeah, that's called social medicine. So socialized medicine, yes. In Australia, it is paid for. Here it is not, which is another reason why we don't see ONERO didn't just jump and go crazy in the States, because it's not covered by insurance. I don't know why, except they don't know what's going on. I've had this conversation several times. It's brand new. I think maybe time will tell. It does get covered under an HSA. So if you have a health savings account still, many people don't anymore, but if you do, it is covered under those. But my argument is it's covered. Silver Sneakers is covered. It's an exercise program. Why wouldn't they cover some of this program that has an evidence base to it? It's just, it hasn't happened yet. I think it's still new. I don't think it's a kibosh. No, it's not going to happen. I just think the access to those systems hasn't been there yet. But right now it's not. I've had a couple of people individually submit to insurance, and their doctors have supported an RX or a prescription for it. The only good news about that, it's not being paid for yet, but there's a couple that they didn't get a slam door no. So I'm taking that as that's kind of good news. So they're in a process of being looked at. They still may get the no for a while, but I just think that it's new and it's not there yet.
Great. Question about, yeah, I hope that hopefully we will get there, but we're not there yet.
Right.
Question about how to measure bone improvement with ONERO and how long it takes to see an improvement.
So bone takes about a year to actually show up on the DEXA. The DEXA scans are what we utilize to actually see that difference. So most of you know you need to be on the same machine to get apples to apples. And people argue, why isn't that? I don't understand. If I put you on my home scale and then you went on your home scale and we compared the weights, they are not going to be the same because the scales are different. Or you weigh yourself in the morning and then you go to your doctor's office and you weigh something different. It's a different scale. That's the simplest version of DEXAs. They're just different. So you got to have the same machine to measure apples to apples. But that's what we're using to see what that change is. It takes about 12 months. What I'm using in my program, in addition to that, is a body scan where we're doing body composition. If I can see muscle mass improvement, what I know to be true is that if muscle follows bone, or bone follows muscle, bone follows muscle. So if you're doing the exercises as we're talking about prescribed, and you build muscle with those specific exercises, almost about 98% of the time, we're going to see a good DEXA. So we do the scans about every 8 to 10 weeks to see, are we on track with muscle mass building? If we're on track, that means we have enough protein, we're lifting enough weight, things are happening in the positive. We can then pretty much assume by 12 months, we're going to get a really good DEXA. That's how we're doing it. And it's been very successful. So.
Great. Deb, what are your thoughts on the importance of stretching?
Oh, stretching is part of that flexibility piece that I talked about in the beginning of the talk. It is absolutely 100% important. It needs to be there. Flexibility stretching is all about your balance, your proprioception. It's not part of ONERO because ONERO is very specific. It's a slice of the pie. But yeah, stretching is, none of us did it when we were young and we were able to do everything. And then all of a sudden we're not young anymore and we need it. So 100%.
Question about protein. Where should we be getting it? Protein powders, meat? What is your take on sources of protein?
I just want you to have protein. I want you to have it in your food. The protein powders, what I talk about is I like the plant-based proteins because they're not inflammatory. Whey protein is generally inflammatory, but you're getting the positive thing about whey is you're getting your calcium with it. So there's a trade-off. If you don't have any problem with dairy, then your whey protein is fine. It's an inflammatory food. Dairy is an inflammatory food. So I try to say, okay, make a decision. What do you need and where you need to go? But I don't care where you're getting your protein as long as you're getting enough. I want most of it to be in food, and then we supplement if we need to with the protein shake. But I generally start people out, my women, at about 80 to 85 grams average per day. Males about 100 to 110 a day. If we can get there and we can build muscle, then we're okay. I don't want to throw you into 130, 140 grams of protein a day. That's ridiculous calories. We don't need that. So we start, because most people are coming in way below that. I got to get you there first, and then we see what happens. If your body grows muscle with that, we're golden. If it's not, we then start inching it up from there.
Great. Clarification, when you said you're getting scans every 8 to 10 weeks, that was not a DEXA scan, correct? That was the bioimpedance body composition.
Bioimpedance machine that I have here. Yes, not the DEXA.
Okay. DEXA is typically once a year or
Correct.
less.
Once a year or once every 2 years, depending on who says you can.
Okay. How long is each ONERO group session?
50 minutes.
Any particular protein brands that you like in those protein powders that you use?
There is a gazillion brands, but one of my favorite is Sprouts has their own vegan protein that's terrific. And then Costco sells Orgain, which has great ingredients. That's another good option. I personally don't like the consistency, but I'm picky about that. It's a great protein. There's a lot out there.
Does it matter if you take your protein before or after the exercise?
100% after. That's a great question. 100% after. So you want your protein 1 to 2 hours after your workout. You work out, you're breaking down your muscle, you're exercising, your body immediately begins to repair and recover. And your food, your fuel for your muscles is protein. So as soon as you get done with your workout, within that first 1 to 2 hours, you put it in, your body metabolizes that right away and puts it in. There's been clinical studies that show that protein in muscles within about 6 hours. So after, before your workout is carbohydrates. That's your energy. Okay. After is your protein.
Great. And I don't want to put you on the spot. I don't know if you feel comfortable talking about this, but there were a few questions in here about the cost of the program. We can either refer people to your website, or if you'd like to address it in this format, you can feel free to, or not.
Come to the informational thing, and we'll talk about more about that. I'll give that information to you then. It's not a big secret. It's about $50 a class, about that. In the group class, it's going to be more than that for the one-on-ones. It's going to be more than that for your assessment. But once we get into the group, it's about that rate.
Great. I think those were, I'm going back because I was scanning through quickly. I'm sure I missed some questions. Dr. Nichols, do you have any comments or questions, or before we wrap it up?
I'm just, my screen just popped up with 20 new messages. It's probably questions.
Oh, I did want to say, I did see a comment in here, which I think is a great idea. Someone asked, can we start a Facebook or X group? I think that would be terrific, so that participants can communicate with each other outside of this session. I know our group has grown and it's hard to really get much interaction with the other participants. So if that's something folks are interested in, we can think about that and maybe send some information out in an email if people would like to sign up for that. Also wanted to just mention that we've had, word about this group is growing. And so we've been approached by some different groups doing research, wanting to hear experience of patients with osteoporosis for different research purposes. So when you do sign up for these lectures, there is a question about interest in participating in research. If you did click yes, we may be sending you links to participate in different opportunities. If you want to update that, if you don't want to receive these, just be sure to click no and we won't bother you. But there are a lot of people interested in hearing your perspectives. And so if you're willing to share, we would be happy to connect you with those individuals.
There was a couple of questions. I'm located in Sorrento Valley. There was a couple of questions about where my suite is located, the gym is located. We're in Sorrento Valley. There was another question about, do I train other people in the US? No, I'm not allowed to train. That training has to happen through the through Dr. Beck, through the Australia program. It's specifically delivered through them. But I have definitely done some mentoring with a lot of people in the US that are interested in getting that license. So if there's somebody that that is interested, they can definitely contact me and I will help them along the process in terms of acquiring the license if that's what they want to do. Like I said, there's a lot of new folks doing it now. But yeah, I can't train. That has to come from Australia.
You're amazing, Deb.
Thank you. It's been wonderful. This group is awesome. I'm so happy again to be here. Thank you very much.
Thank you. This was so informative and motivating, and we're really delighted to be able to offer this.
Beautiful. And the QR code is working. I can see things coming through right now. So the QR code is working. So good.
Great.
Okay.
What were
All
your
right.
dates for next week again? Just to remind
Monday
us.
at 5:30. Monday at 5:30.